What up, what up, what up? J Steve here, back with another one, or back in the flesh, or just I'm back. It is May. Can you believe it already? The year is almost over. 2018 officially started and officially over. Already, that quick. So, I forgot to post a couple videos, but I have been having the camera running 24/7. I'm going to try this video in one take. So I have a lot of video I'm going to upload after doing this video. This video is going to be your top 10 questions for the week. And I got couple response in the comment field. So thank you guys. Thank you. I normally will tell people who ask a question unless they want to remain anonymous. So I just do a general questions. But thank you for just asking question. I love this segment. My mom loved this segment. My friends love this segment. And I want to keep this segment actually going. So without further ado, let's jump into question, and I'll try to elaborate on some of the ones that are longer. And then I'll go ahead and just tell you what I've been up to, and then get ready to post the videos tonight that I've been doing for the last 5 days. Alright, so let's turn it on. Let's jump in here real quick, and let's see what your question is. By the way, how's everyone doing today? Hopefully you guys are enjoying it. Hopefully you guys are out there. Put some sunscreen on. If you're new to the channels, please subscribe, like, share the video, guys. I'm trying to make this a full-time job. Not necessarily replace the job I'm doing now, but full-time job. And also try to keep the video under 5 minutes. And I'm actually in almost 2 minutes now. So let's jump in there real quick. All right. So the first question is, how is your hospital about background check, and what are they looking for? That's number one. So when I was hired, pretty much you just do a physical to see if you can lift about 50 pounds, and they have you walk between a hallway, probably about probably about maybe like 10 feet or something like that, just to see how you can handle lifting stuff up. And you do a basic urine test. I think anytime you work around meds, they always have you do a urine test. As far as background, they probably just do a regular background to check to see if, just a general background for like, criminal charges, because you are working with meds. I don't think they're looking for anything in too detail, but just a general check for, just for any job you go through. So urine, physical, and a general background criminal check, and also to make sure you're up on your vaccination. And the good thing about my hospital, if you're not up on your vaccination, they give you all your vaccination at no charge. Alright, so that was a good question. Thanks for asking that. That's one of my subscribers that actually asked that question. Number two, have you ever seen someone with a gunshot? That's one of my other subscribers. No, I physically haven't seen it. We have these codes in the back of our badge that kind of tell us what's going on in the event. Within the hospital, and sometimes you hear nurses, so you might hear something like the after certain meds, and then by the time you walk it down, because it's not stocked in the Pyxis, the nurse might say, oh, he got, you saw the blood on the floor or something like that. But I personally physically have not seen someone with a gunshot wound, or actually saw, I've heard a lot of story about it in the ER. You know what I mean? But I personally physically have not seen someone with a gunshot wound. That was number two. Number three, and this was a new question too. What's a good study guide? So for anybody who wants to get into pharmacy technician, I passed the boards a while ago now, so I don't know what they're actually looking for, but I can always do research. If I don't know an answer for a question, I can always look it up and get back to you. But I do keep in touch with new texts that come out. And most of the stuff that they definitely still ask you are your top 100 drugs. Not saying they give you the whole top 100 drugs, but, generics, top generic name, they'll do your top blood pressure, your top cholesterol, your top antibiotic, your top antifungal. And they ask you a lot of math questioning too as well. And they try to ask you a lot of questions that pretty much trick you. So they might give you two name of a drug and want you to do generic. But anybody who wants a actual study guide, I'll look that up and put a link below. But if you go to tcb.com, the pharmacy board, they have a lot of practice exams for the actual pharmacy board tech, and it can kind of show you what kind of stuff they're gearing to. So that's a really good question. Hopefully, I'll try to see if I can get the actual book that I use or the books that they're using now and see what they're using for that. So that's number 3. Number 4 was I want to do a diploma in pharmacy technician. All right, so not necessarily geared to number 3 question, but pretty much most places who hire you retail from Maryland, you have 6 months to do it. The pharmacist can either sign off that you're ready to do the exam, and then you pretty much go ahead to PBC with your sign-off declaration showing that you've completed some kind of a training or have some kind of skill to do the exams, and then they'll let you sit the board. So it's pretty easy. Or you can just go into your community college and see when they're offering courses. I know a couple community colleges, what they'll do is they'll go ahead and see if there's enough people sign up for the classes to do. But normally within 6 months you can take the exams with somebody to sign off or doing the courses. And, you know, if you pass, you just renew it in every 2 years. I actually have in one of my top 10 questions showing you how much credits you need to keep your license up to date. So hopefully that helped you guys so far. So number 5, how often do you fill Pyxis? So we fill Pyxis every day pretty much. We do one big fill in the morning, and then throughout the day when stockouts print out, we'll go ahead and fill that. How often do you get drug overdose? Okay, good question. That's number 6, and number 5 was Pyxis. A lot. You'll hear them call certain codes for drug overdoses. They'll want a lot of fluid bags. They'll want Narcan. So we get it pretty much often. We get it often enough. Plus, I said Maryland right now, one of the biggest drug is meth. So we do get a lot of meth users that come through. So number 7. What does ICU stand for? That's pretty easy. Intensive care unit. A lot of people who need very intensive care, they go to that unit overall. Number 8. Can you have nails when doing IVs? They don't recommend nails, jewelry, and stuff like that when doing IVs. Pretty much like maybe have it a little bit long, as long as it's not tearing through the gloves when you put your gloves on. But they recommend having low nail because under the nail keeps dirt. Number 8, facial hair when doing IV. So I have a facial hair. They do have a face mask that cover. But if you have a full foot beard, you know what I mean, obviously it can be covered. But they'll hire you as a technician. You don't have to cut your beard as a technician. But they want it to be as clean as possible when you're doing intravenous medication. So that was number 9. And last but not least, number 10. Can unused meds be returned to the pharmacist? So good questions. I know in retail, some of the medication, when they go out to the customer, if they're the right one, the insurance doesn't allow it to come back, especially if it's open because we don't know what happened. Normally when we put meds for the patient, if the nurses doesn't carry it to a room that's isolated, or they don't put it to, you know what I mean, a droplet room, anything that the patient does not get charged will normally bring it back. Now some software system allow the patient to get charged upon scanning the meds for administration. Sometimes you know it's billed before, but you can credit. So yes and no, but mostly yes for the hospital. All right, guys, that's one of my top 10 questions. I think I did it in one take, but I was 3 minutes over. I'm gonna wrap this up real quick. I got a lot of video to edit on my weekend in Pottstown. Couple shopping vlog. And please keep the question coming, guys. I'll answer as good as possible. I'm doing one take. And I'll look for any kind of books or anything I can recommend for anyone who wants to do the board. And if you guys need help doing the board, shoot me a question. The one thing I can tell you is one note. Let me drop a note for you. It's multiple choice. And I would say if you can get a strong percentage of it done, you're fine. But try to know your conversion chart, your centimeters, your kilogram, your meter, stuff like that. Learn those conversion, your liquids, your teaspoon. Try to do your conversion because they're going to ask you a lot. And read the question twice because they might try to trick you. But when you really break down the question, you realize. All right, guys, those are my top 10. I'm going to make sure, rewatch this to see if I did actually 10 questions or I skip over one. Stay tuned for a couple more videos tonight. Peace!